12,000 Twin City nurses' contracts expire June 1st, and they feel they're getting nowhere with negotiations. Today they were outside Allina Healthcare in St. Paul at their Nassif Heart Center. I wanted to hear what they had to say in person.
I'm a Master of Public Health, a registered nurse. I work at United Hospital. I'm a resource nurse on the day shift. I'm also a member of our collective bargaining committee, and also the nurse representative to the Allina Pension Committee. We're at a very pivotal position here in this bargaining, in that we really are all about protecting our patients and ensuring getting staffing language that will help us take good care of patients who are increasingly medically complex. A lot of the patients that we care for today, 10 years ago, likely would not have survived their chronic illnesses.
For this building and this employer, or are you here for larger reasons too?
I'm here for larger reasons too, because I really feel that the collective voice of nursing and the power of that is what enables us to advocate for our patients. And now with national health insurance in some sort of way, shape, or form coming out, nursing has to be organized.
I say too, at the state capitol right now, everything is in play.
Yes, absolutely. Healthcare for people who are disadvantaged, healthcare for disabled people, healthcare for poor people. We're all supportive of that, and we're working against the governor to see if we can...
What happened to the GAMC compromise?
It fell apart.
It seemed like it was almost a football.
Yes, yes.
Because for about 48 hours there was a glow around it, and then people read it and said, we're pulling out, we're not actually going to participate.
And you know, oddly enough, we were there. A lot of M&A was there, a lot of other advocacy groups were there, but our managements, our administrators, people who lobby for these healthcare, for the hospital corporation, none of them were there. They were conspicuously absent in this fight. So even though they like to threaten us that these costs will really affect their bottom line and our ability to get benefits, they really weren't there to advocate for those people.
You think they have a different goal than you?
I do think that they do. I quite believe that they do. I think they look at the world a little bit differently. I think that they're looking at this bargaining as a way to really advance that frontier of control that exists in workplaces.
What are the issues here?
Patient care. Our abilities to protect our patients, advocate for our patients, and ensure that our patients are safe. Those are really the issues.
Universal turnout, it looks like, with what you could muster here.
We have a good turnout. You know, our nurses, we're really nearly of one mind about this. 12,800 nurses looking at this bargaining as an opportunity to really move our profession forward.
Are they asking for something back from you?
They're asking for everything. You know, it's as if a thief were to have broken into my house and has stolen all of my possessions. And my house, of course, is my contract. And now they're trying to sell me back my own television set, my own living room furniture. That's really what this bargaining feels like. They're after language, they're after benefits that they have agreed to for the last 45 years.
How is their profit? Are they hurting right now?
No, they're not hurting. If you and I were to drive around the Twin Cities, the only companies that have cranes in the air, that is people that are undertaking private planes, but also the cranes where they're undertaking major capital projects, are hospitals. No one's building a new department store or a shopping mall. No one's building a new factory. It's hospitals.
You know, they're praying for a 3% profit in many of those businesses.
Yes, yes. It's not a bad profit margin. And again, to compare and contrast, we're about patient care. We're about protecting our patients.
I've known a couple nurses.
Have you now?
Yes, indeed. In fact, I've worked medical for many years and on psych wards mainly.
Oh, sure.
So I can say that I don't think my compensation actually ever managed to fulfill what I was doing.
Sure.
For the number of hours and what I gave.
That's true, but you know what?
So you have an altruistic heart to start here.
Sure. Well, and you know what? If we really were money people, we wouldn't have chosen nursing as a career. We're not people that are motivated by money. We're people that are motivated by advocacy by protection, ensuring that our workplace is safe, ensuring that our patients are safe.
What happens when you try and direct dialogue with them? Are we in negotiations currently?
We sure are. We sure are. In fact, I left the bargaining table to come to this little event.
Perfect. Tell me what's going on at that table.
Really nothing. We have at Alina, in any event, we have 48 pages of concessions, and they do represent changes to contracts that have been in place for over 50 years, and they haven't moved anyway at all off of that.
How long has this negotiation been going on?
We started negotiations with Alina on the 18th of March.
We're out here to protect our patients. We're out here for patient care. We're out here for better staffing, so they won't take away our retirement.
Do you think they're going to listen to you now?
We're hoping so. If they don't, we can go farther.
The pension, they're trying to roll back the pension to 1968 contributions. They want to cut it by a third.
It's kind of confusing to me from outside.
They're trying to cut the we have a fixed benefit pension, which, even though it's not a lot, is great. And their big thing is because other corporations have basically gone back on that benefit. We're like blessed to have it. It's not true. We made compromise. We gave wage compromises, all kinds of compromises since '68 to keep the pension. And the money they're talking about, I figured out. My math may not be right, but they're talking about cutting the pension $7 million a year.
Their contribution?
Right.
And
that's between all the hospital organizations. That's less than the bonuses the CEOs get.
Patient care! And this is about patient care. What's this about?
The staffing is how many nurses do you have to take care of the patients that are there, the patients that you might get.
Patient care!
When we don't have enough staff, we're not safe. When we're looking as charge nurses as what might happen, for example, on labor and delivery, someone comes in, needs an emergency C-section. If we don't have the staff, that's going to be delayed. That's not going to be safe for that mom and that baby. When we don't have the staff and the skill levels that are appropriate, so that the highly skilled nurses can train the nurses who still need more precepting. It's not a nurse is a nurse is a nurse. It is what skills do you have, how many do you have there to handle what is there and what comes in.
Well, I think the issues that they're raising in their contract negotiations around supporting our patient safety, nurse-patient ratios, making sure that nurses have the kind of professional decision-making authority that they need, making sure that they have stable jobs at good wages, that they have the the ability to
right now they're
rely on their
people inside this building, and they're asking for something back from the nurses still.
Yeah, I mean, to be sure, there's a lot of pressure on the entire healthcare system all over, but there's just no shortcut to patient safety. And the kinds of issues that the nurses have been bringing up, that they've raised and brought to my attention, folks who can't rely on a reliable schedule from week to week to week. Some fairly frightening stories about patient safety and nursing staffing ratios, some taking back of the kind of professional judgment and responsibility from the professionals who are on the floor closest to the patients. It's all a subject of this contract negotiation and worthy of the public's larger awareness
I
and
look
concern.
at this two ways because I'm following what's going on at this Capitol very closely, and the GAMC compromise.
Right.
And then I've mentioned it to some friends, and they've also said, what are you talking about completely? Having no awareness whatsoever of these issues. So I guess I see both ends of this. You look like you want to say something.
No, I'm not much. I let Scott do the talking.
Well, I actually like the first impulse is usually the best answer. I encourage.
And you're from?
I'm for the uptake.
Okay.
And I look at this two ways, a couple ways, because I've actually done healthcare myself too. I've spent 15 years on a psych ward with a key around my neck. And I know what it's like to actually argue over staffing. It's a personal issue for everybody out here.
Right.
They actually know directly somebody who it affects. It's not an abstract number to them. So, however, I'm not so sure they're conveying that very well.
You're not sure they're conveying it?
Yes, I think now it's actually hard to get your message across to people. It's not exactly easy. People have this. Most people who look at this issue tomorrow are going to read the first 6 words about it, the headline, and that will be their encounter with it. Now, how you shape those words is pretty scary then, isn't it?
It is.